Hello, and welcome to our virtual panel discussion on Asian American, the mental health crisis in our Asian American community. I'm pleased to bring this panel discussion to you, brought to you by API and Allies Employee Resource Group, the Center for Asian Health Research and Education, and Medicine in the Muse Center for Biomedical Ethics. My name is Bryant Lin. I'm co-director for the Center for Asian Health Research and Education, as well as I am the director of Medical Humanities and Arts at Stanford. Thank you for joining us today for such an important topic. Less than 9% of Asian Americans sought any type of mental health services, compared to nearly 18% of the general population nationwide. A survey released in October by the National Alliance for Mental Health found that 77% of Asian Americans with mood disorders reported struggling to talk about their condition, compared to 69% of white people. The rise in anti-Asian hate has taken an added toll on mental well-being, increasing their need for mental health support. So really great thanks for joining us today to discuss such an important topic. Rather than, we've really experienced incredible violence in our country over these past weeks and years. Last week I led a webinar during lunchtime for our faculty, and I held a moment of silence. But seeing the news today, really a moment of silence is not enough. So I encourage you, instead of taking a moment of silence, please reach out to your politicians. We've got to fight for what we know is right. We've got to really fight for the safety of our children and our community. So please join me in reaching out to politicians, policymakers, to really change our community for the better, to decrease violence and also to treat mental health. Without further ado, I would love to introduce our first speaker, our first host. Charlene Platon is Director of Ambulatory Nursing at Stanford Healthcare, where she collaborates with operational and clinical partners to advance, develop, refine, and innovate ambulatory nursing clinical delivery operations throughout the enterprise. Currently, Charlene serves as co-director of events and programs of the API and Allies Employee Resource Group at Stanford Healthcare. Thank you, Charlene, and really great thanks so much for inspiring and organizing this event today.
Thank you so much, Brian, and good evening, everyone. We so appreciate you all joining us today to discuss such an important topic. And as Brian mentioned, my name is Charlene Platon, and I currently serve as co-director of programs and events alongside my colleague Tracy O for the Asian and Pacific Islanders and Allies Employee Resource Group at Stanford Healthcare. And the mission of the API and Allies ERG at Stanford Healthcare is to foster the unique values, practices, and strengths of each of our diverse cultural groups to promote a more inclusive and diverse workplace at Stanford. And I'm so honored to be here today to support this panel in collaboration with the CARE team and the Muse Center, and to discuss the timely topic of Asian American mental health. And now I'm excited to introduce our moderator for this event, Lisa Kim. And Lisa Kim is the Senior Manager of Media Relations for Stanford Healthcare and the Stanford School of Medicine. And she also produces the 90 Seconds with Lisa Kim series, which features faculty and their research work taking place on the Stanford Medicine campus. Lisa is an Emmy Award-winning journalist who has anchored and reported the news on both national and local level. Lisa, I'll turn it to you.
Thank you, Charlene. But my most current joy is the 90 Seconds with Lisa Kim. But tonight, sorry, it's not going to be 90 seconds. It'll be more like an hour. So you'll just have to deal with me. It is a pleasure and honor to be here tonight to host this webinar. As Charlene mentioned, this is a very timely topic, unfortunately, a timely topic. We all know what happened yesterday in Texas, that horrific shooting of the children, of the teachers. It's just unimaginable what happened. And a lot of people are really checking themselves when it comes to mental health. There's got to be an outpouring of what you feel and what you can do, and how you can communicate that. I just want to tell you briefly that we had our communications meeting this morning, and it wasn't so much about what we needed to do that day in terms of tasks. It was talking about what happened yesterday. How are you feeling? How are you processing it? And how do you get through it? And, it was just an emotional release. People were crying because just of what happened, just the sheer magnitude of the lives lost, and also how each person was feeling it, how it touched their hearts and hit close to home. So that outpouring, that communication of how everybody is feeling plays a major role in mental health. And it is a mental health crisis, especially among Asian Americans, Native Hawaiians, Pacific Islanders. We all go through it. And the problem is, how do we express it? How do we seek help? So tonight, that's what we're trying to do, is to find ways to seek help and help everybody, that's affected by a personal tragedy or tragedy that's on a nationwide level, such as the shooting yesterday at that small town with a Texas school. So let's get to it. Let's talk about mental health. Let's talk about how we can attack it and how we can help each other through this process. And it is my pleasure to also introduce our panel of experts tonight. First off, we have Dr. Ronik Trivedi. She is an assistant professor of psychiatry and behavioral sciences from Stanford University. Her work is focused on understanding how families and patients can better collaborate to improve health outcomes for both. Her work has highlighted the need of improving assessment and treatment of mental illnesses in primary care settings. We also have Dr. DJ Ida. She is the executive editor, or rather the executive director of the National Asian American Pacific Islander Mental Health Association. The National Asian American Pacific Islander Mental Health Association is a nonprofit organization committed to promoting the mental health and well-being of Asian American and Pacific Islander communities. Next up, we have Dr. Pata Tsuyomoto. She is the director of training and programs, the Native Asian American Pacific Islander Mental Health Association. We also have Dr. Shashank Joshi, personal friend of mine and colleague, worked with him before. Just a side note here that Shashank is joining us from SFO in an abandoned toll booth. That's how dedicated this man is to joining this webinar and talking about this timely subject. He is a professor of psychiatry and behavioral sciences from Stanford University. Professor Joshi's scholarly work focuses on school mental health, suicide prevention in school settings, cultural aspects of pediatric health, doctor-parent-teacher collaboration in medical care, and well-being promotion in youth and young adults. We also have Dr. Yuhan Shea. She is a psychiatrist and the clinical director of specialty mental health at Asian Health Services. Asian Health Services Specialty Mental Health Program provides prevention, early intervention, and treatment services for people with mental health conditions. The staff is bilingual and bicultural in Cantonese, Japanese, Khmer, Korean, Mandarin, Mien, Vietnamese, and English. And last but not least, we have Andrew Subika. He is an associate professor of social medicine, population, and public health from the University of California, Riverside School of Medicine. Dr. Subika's research examines and addresses mental health, substance abuse, and physical health disparities in vulnerable populations. He is especially focused on designing and testing evidence-based interventions to address the behavioral and structural causes of health disparities in vulnerable communities and studying the effects of key determinants such as cultural trauma, social disadvantage, and stigma on population health. I once again would like to welcome and applaud these experts on our panel tonight to discuss this very timely and important topic, that is mental health and the crisis that we are facing. So let's start off with Dr. Trivedi. Dr. Trivedi, Asian Americans are less likely to seek mental health services and less comfortable to talk about their conditions, even with their family members, compared to other ethnic groups. How can families work with patients to have an open conversation about mental health and eventually improve their mental health?
Thank you, Lisa. And this is such a great event. I'm really appreciative of the people who are organizing it. And I want to echo the sentiments from earlier and with the shootings in Texas and the murder of the children and the teachers. Moments of silence are not enough, as Brian said, and I just want to echo that. In terms of the families, it is true that there is a mental health stigma associated with in conversation with the families. And I think there's a few different ways that we can approach that in this community. One is what we have heard from our work is that we need to reach in better. So if you sort of see somebody within your family who you think might be struggling, see if you can make space to give them an opportunity to share with you. So as somebody who is a family member, see if you can make that space. I think it's important for all of us to recognize that there is a lot of stigma and have open conversations whenever possible. And this can be really awkward, when you're talking about mental health. This is not a big family conversations we tend to have, but I think it's important that we do that in group settings. And we know that there's other ways that this kind of gets joked about and gets mocked. And it's important that whoever is representing people who are trying to have this conversation, that we offset that by saying, yes, it can be funny, but also it's really important that we talk about this. So I think that we need to create those spaces individually, one-on-one, but also in group settings, because we know that people who have Asian heritage tend to congregate as groups. And if we have this conversation in groups, we create a situation where these conversations can land better. So I would suggest that we all go into our communities, into our families, into our conversations with an open mind and an open heart about this. The other piece of it is we need to make sure that we are raising awareness. The stigma is so big that people are not able to share even with their most intimate connections that they're having mental health issues. If we can create a situation where people can feel comfortable or have an ally within their family, within their friend structure, having this conversation, that can be a big lead in to having those conversations. So I would really encourage all of us to make that space. And if you yourself are struggling with mental health issues, think of people who in your community, whether it's your family or your friends, who is open to having those conversations with you.
Those are important conversations. Yes, they are. Dr. Ida, your intervention project focuses on improving provider cultural competency and continuity of care for at-risk Asian Americans, Native Hawaiians, Pacific Islanders. What can we do to get more Asian Americans to seek mental health? I mean, we talked about maybe the cultural barrier there, that we as Asian Americans don't seek help, that we are trained in a way to hold it within and just get on our own feet and just power through it. How do we get Asian Americans to reach out and get help?
That is such an important question. And I actually want to sort of piggyback on a couple of the comments that Dr. Trivedi said, because I think it's sort of taking from there. One is raising awareness. And events like this, and I really want to say thank you very much for inviting us to be a part of this really important conversation, because I think the more that we're willing to talk about it and to say that this is very real, that's going to be really, really, it's really, really critical. When I think about, and then the other piece is just being able to find that place of being able to deal with our own pain and everything. The COVID-19 did a real number on the entire country, on the world, on so many different levels. And for Asian Americans, there was the added because of the racism that was there. If there's any good thing to it, it raised the awareness to the point where it became normal. It wasn't mental health didn't belong to somebody else. It could happen to anybody. It could happen to me. So that's one of the things when we're talking about the stigma. It begins to take the stigma away because it isn't, oh, there is something wrong with me. We always tell people, if you're breathing, mental health will be part of your life in one way or another. And it can be the full continuum. And that the part about self-awareness, I remember, we are now in this, we're all just, I think, reeling from the news that we heard yesterday. But I remember after the Atlanta shooting, a very dear friend of mine called that morning and just said very simply, I just want to see how you're doing. I didn't realize how much I was holding in. And we're all trained as clinicians, we're all trained to do this work. And I realized that we weren't allowing ourselves to grieve. We weren't allowing ourselves to feel the pain. And I just wanted to just let loose. And I'm thinking, when we give permission for communities, one, it's normal to have these feelings. There's nothing wrong with it. That understand where you're find the safe place to be. But the second part of it, you can do talk therapy, which can be very powerful. But I think the other part, just in closing my comments here, is there's lots of different ways that we heal. And talk therapy is more of a traditional Western way of doing things, which again, I know how very powerful it can be. But that's not comfortable for many of our communities. And there are other ways of healing. That's why when we do the training, it's looking at the relationship between the body, the mind, and the spirit. And I want to go back, very last comment here, because I really want to make sure I have time for all the others. When Brian first opened up and said, what happened was horrible, lighting a candle, having a moment of silence is not enough. When we take action to do something, that can be very, very healing, that I'm not alone. There are things that I can do. And it's getting out of that space of, if I can make the world around me a little bit safer, making sure that elected officials, and I'm not saying who you vote for, this is very nonpartisan, but it's what can we do to make the world around us a little bit safer? What do we do to stop the hate crimes? That too is part of mental health. So I think it's a very complex issue, but again, I want to say thank you very, very much for inviting us to be a part of this very, very timely and such important topic. So thank you very much.
Thank you, Dr. Ida. Let's move on to Dr. Tsuyamoto. Can you share your experience of seeking mental health, how culture affects your mental health, and how, again, you can convince Asian Americans, Native Hawaiians, Pacific Islanders to seek out that help?
Sure. So I'm a person with lived experience with mental health concerns. And I'm a suicide attempt survivor, as well as an impacted family member. My mother and my daughter both, my mother had bipolar disorder. My daughter has it now. I'm also a person who has a master's degree from Stanford and a PhD from the University of Pennsylvania, and currently work as an APIMA's training director, as well as the director of NAPIAN, which is a National Asian American Pacific Islander Empowerment Network, which is a network of individuals with lived experience and mental health concerns. So I am the poster child, if you will, for the fact that you can heal. You can heal. And as an Asian American, I feel like it's really important for us to be out with our healing, if you will. It was difficult to find a therapist that had cultural humility. No one ever asked me. I'm 60 years old, and until my current therapist, no one ever asked me the impact of my culture on my mental health, ever. And like was said, we're least likely to seek services. I never saw an Asian American practitioner, nor did I see very many people there, clients either. And when the pandemic hit, my daughter, who desperately needed psychiatric services, went to the ER in crisis, and they sent her home with nothing, no treatment, no referral, nothing. Our system is clearly broken. And I got treatment in part because my situation was so dire, my family could no longer ignore it. I made a suicide attempt. And yet the stigma in my family and our communities, it was very silenced. My mother was sick. No one ever talked about her mental health concerns, whether the impact it was on me or my sister. So, I mean, there was this sense that, that you shouldn't go outside of your family. It's not encouraged to go outside of the family. And that even when you need professional support. So, and I want to say that, there are so many AAPIs that are suffering, and you don't need to be suicidal or crisis to get mental health support. You don't need to do, you can just be stressed out, and there's support out there. Certainly culture is impacted. My father was in prison during World War II in an internment camp. So there was a lot of questions about what it meant to be Japanese American, assimilation, all those things. Silence around mental health concerns. And then more recently that, AAPI hate, that has definitely affected those of us who have trauma. It just brings that trauma right back. And I would say, don't be afraid to get help. And that self-care is not selfish. That's sort of the messages I have.
Those are great messages. And thank you so much for speaking about your personal experience. I'm sure there are many experiences out there that mirror yours. I can think of my own family as well. And the struggles about really addressing your mental health and seeking help. I hope tonight that if there's anything that people take away for tonight, there is help out there and there are people willing to listen. So please just reach out. Dr. Joshi, you're next. I just want to rattle off some statistics for you here. According to new data in 2021, more than a third of high school students reported they experienced poor mental health during COVID, and 44% that is, reported they persistently felt sad or hopeless during the past year. I know just personally that my son, who's a senior in high school, when he was going through the pandemic, there were bouts of sadness and depression, of not being around his friends when he was used to going to school every day, seeing his friends. It wasn't just an academic experience, it was a social experience. So that sadness is pervasive throughout the school community, in schools, with students, with parents, with families, with teachers. So I asked you, what are the lessons learned, some of the lessons learned from COVID, and how can we help?
Yeah, thank you, Lisa. And to the other panel's members, Dr. Suyamoto in particular, really appreciate you sharing your story. And I'm very sorry to hear that, no one really asked you about your cultural heritage and what it meant for you. As a program director, I know there's more than two of us on this call. As a program director, it's so important. I mean, in our child psychiatry fellowship, we teach that culture is part of each and every interaction. And, as Asian Americans, we have 24 different drop-down menus in our research studies in the box. It's not like we're all one, but in many ways we share common struggles, but we're very individualized, even among a diaspora from a certain country. So it's crucial, and I think that is changing. But we learned several things in the pandemic. There were, of course, the learning was turned upside down, and we knew there'd be disrupted learning. What we didn't predict is how much we took for granted the everyday doses of well-being we got from connecting in person, our students with their friends, our teachers with their staff peers, parents seeing each other during drop-offs, and nothing like really missing something until it's not there. And so with the return, an interesting phenomenon here is where it's been extraordinary for most students to be back in person, not only academically, but as Lisa said, socially, emotionally, around connection, and also around a sense of belonging. We know that that sense of connection and belonging is a research measured enterprise that makes a difference for people with mental health problems. If people can join a community and if they can be themselves, they can connect and develop that sense of belonging. And if not, they're forced to try to fit in. And, in the Bay Area, we're close to 40% Asian American, but we're only 7% nationally. If you're in a community where you are the only Asian American, like I was in my school growing up, I was extraordinarily fortunate. I did not perceive any bias or discrimination when I was growing up in the 60s in Wisconsin. but there certainly are stories now all around the country. And if you're the only one, do you fit in or do you belong? Can you really be yourself? And so I think being able to talk about cultural identity is important for young people. It's also part of their own story. And when we talk about stories, and Dr. Suyamoto, you just shared part of your story, Dr. Trivedi shared hers, Dr. Ida, like, we've all got something we're bringing to this tonight. And Lisa, congratulations to your senior, by the way, and to your family for making it through. I think the stories really matter. So tell a story tonight about something you heard. We've got to take stigma on one conversation at a time. And stigma does not discriminate based on our cultural background. We know stigma happens everywhere. The way to defeat stigma is really to talk about mental health. In schools, we talk about mental health as part of overall health. And our children and teens have to be healthy enough to learn. And our teachers need to be healthy enough to teach and lead these kinds of mental health conversations. And some of the research, which has been funded by CARE, by Stanford CARE, has really highlighted the importance of the role of teachers and overall mental health and well-being, especially here in the Bay Area, where we have such a high proportion of Asian diaspora students, most of whom are being raised by immigrant parents who did not go to high school here and who are doing their best to raise their youth in a bicultural fashion. Those that can really honor their heritage while also acculturating at very different rates here, being born and raised in the US. So that's another challenge in an area of research that our group is interested in. And we're finding some very interesting pearls. And one of them is, as I mentioned, is just not taking for granted the everyday doses of connection, whether it's in school, but even at home. We have found that there are ways to cultivate those connections.
Thank you, Dr. Joshi, for those pearls of wisdom. Take those anytime. Let's move on to Dr. Shea. I want to ask you, what are some of the challenges and key barriers you see from the Asian American community when it comes to seeking help, that is? And then also, what would be some culturally appropriate solutions?
Thank you very much, Dr. Kim, for the question. And I'm also very honored to be in this panel. And I think this is such a important topic, and also such a critical time in the nation, and also for the community too. And of course, Asian Health Service, we located in Chinatown of Oakland. And it's a very, very, I would say, if I walk there, I have to say it's a very unsafe place. But when I talk about challenge, I also wanted to emphasize that we see tremendous resilience also in the community, also among our staff too. But since the question is about challenge, I just want to say, every one of you have touched some of those, such as, stigma, such as resource, such as cultural barrier, such as a lack of service. And I just want to talk about, what we see. Our population is slightly different from what we see in the private practice. That is a low-income Asian immigrant kind of community, and they come from China, Vietnam, Laos, Cambodia, and the majority of them has experienced some trauma in their home country before they come to this country. And now they are raising their children in this family. And I think, number one, they really don't, I would say they don't have much knowledge about mental health symptoms at all. All they know is, I cannot sleep, or I have headache, I have stomachache, I cannot get up today, I was angry with my children. And one of my patients I had for 5 years, she feels tremendous guilt, but she always lose temper in front of her only daughter. She's divorced, but she doesn't know that this is a symptom of depression. And I have another patient who has been seeing me for 2 years. She said, if you can just, give me something, allow me to go to sleep, I will be okay. And she doesn't feel that she has anxiety, of course. We talk about anxiety, but she just see, those are her problems. So I think we as a community, we definitely lack the knowledge of the symptom of mental health. And then we also don't know about resource. I was joking, I'm an immigrant. I'm the first generation of immigrants. I come to this country, I didn't speak much English at all. When I had my training at Duke, and Duke was so kind and actually sent me to see a speech pathologist to help me to correct some of my pronunciation. So, I have to admit the system is so complicated, and even me to understand what's the difference between the benefit of medical care, mental health care, dental care, and the medication benefit, it's huge with somebody who does not speak any English to understand such a complicated system. I had a patient with whom I'm working in Sacramento. She said, if you throw me in a jungle in Vietnam, I can find food, but now I'm in US. I need to walk almost 2 hours to come to see you. How can I even cannot find the food. And how can I navigate that system? So the resource, although they are limited, but they are there. And even that, they don't know they exist. So I think everybody talk about stigma and the shame, mental health is seen as a weakness of personality, it's a shame for the family or community. And also of second generation of Asian American are seeing you are the model citizen, you probably should do very well. How can you even have mental health problem, right? So all of those are very, very important. And the last thing I want to see a big barrier, actually our organization hired 2 consultants to work with us because we are losing our bilingual and bicultural staff because the pay is so low. And because the surge of patient population, we are unable to, keep our staff. We're losing one staff to Stanford, and we are losing staff. And so we had 2 consultants come in to help us to build the morale. So those are all of those are a big challenge in the community. In terms of what should we do? I think every one of you guys have said wonderful ideas. I would say, really, ask the clients about their belief about their illness, and really actually avoiding label it as a mental illness. Maybe we talk about the ease, because we now recognize there's so much body and mind connection. And then if we go along with the biological kind of, ideology, actually in Asian populations, much more acceptable. And so to avoid that kind of sounding that that's your weakness, is your psychological weakness. And I would say religion, tradition, community support is very important, and that we do a lot of outreach. And what we found out, if we do outreach through community partner, we are way much more successful than we just go out to say, we're coming to talk about mental health. And of course, about the language, of course, when you cannot hire a bilingual kind of staff, and I think, we will need to be kind of humble. We just ask, and and that we listen to what our clients or patients say. And I think, of course, I have a lot of, other kind of experience too, but I want to stop here. But before I come to the panel, my staff at Asian Health Service has asked me, when you go today, you're going to meet a lot of people doing research. Please ask them to do research in our community so we can understand a treatment model really works for the Asian population, because we have patients once into the specialty mental health service, we just never able to discharge them. And there's very little research for us to go along which model to work with. And I did research many years ago. I did my research on the literature. I have to say, yeah, that's true. So thank you, guys.
Lisa, you're
Lisa, you're on mute.
I was testing you guys, if you could hear me. Thank you very much, Dr. Shea, for that valuable input. Andrew, I want to ask you, what are the challenges that you face what the Pacific Islander community faces when it comes to seeking mental health? And then also the evidence-based interventions. How much do those interventions help?
Well, thank you, Lisa, for the question. Honestly, before I even launch with the question, honestly, this is an amazing panel. This is just really cool to hear all these feedback. You called it pearls of wisdom, Lisa. I agree 100%. And a lot of, I guess, what we find for Native Hawaiian Pacific Islanders in the research I've been doing has already been stated. You know, there are some parallels between Asian American and Native Hawaiian Pacific Islanders when it comes to mental health, especially that treatment seeking is so low for both groups. I mean, that seems to be pretty uniform but what's really, I guess, I can expand on is we've actually done really targeted studies on what are the barriers for Native Hawaiian Pacific Islanders, because, and I guess the 5-second thing is, I was trained as a clinical psychologist. I really was focused on developing better treatment models, better culturally responsive treatments. Then I started talking to the communities out here in California. And the main thing they said was, Andy, create all the treatments you want. We are never walking in the door. And that has really kind of driven a lot of my work now is in community, because that's where the need seems to be, this unmet need. So we actually did a number of studies to really kind of quantify what's happening in the Native Hawaiian Pacific Islander community. The first one was stigma. It's come up a lot. We all know what's happening. I was really fortunate to work with a sociologist who does a lot of stigma work named Dr. Bruce Link. And we actually tried to explore what does a context look like for Native Hawaiian Pacific Islanders. And we found that based on every indicator we would look for what type of context would be very stigmatizing, would cause someone to feel unsafe to seek treatment. We found things like Pacific Islanders were more likely to see depression, schizophrenia as caused by social or moral factors. So this would be weakness, sin, a lot of the things, as opposed to these neurobiological factors, which would be less stigmatizing. We also found things like, I give credit to Dr. Link here. Pacific Islanders see it as less serious, more likely to improve on its own. I believe also less likely to improve with treatment compared to the general population. So we're able to compare that. So stigma was really prominent, very interesting. But the other one was some that had come up earlier, this low mental health literacy. And it's not for Native Hawaiian Pacific Islanders alone. I feel like no group has great mental health literacy. That's just a feature of our society, actually, I think. But for Pacific Islanders, they named that as something that was really important, which is why there were so many misperceptions and stigma. So they felt like if they came out with it, they would be seen as damaged, having bad blood, that it would be a shame on their family. Really interesting types of things. And the third one was lack of knowledge about the treatment process. This is something I've not heard of before, and this is the important one, actually, is there were just so many questions that they basically had. How do we find treatment? How do we track down? How much does it cost? And then confidentiality was the number one. Nobody really had confidence that if they saw somebody, they would be protected, that their community would not find out. And so the reason I think that's a great question is mostly because those were the 3 targets now we're trying to address in an intervention. You know, we had to find the barriers to really try and target. So now we have an intervention that we're developing to address mental health literacy, anti-stigma, and then I call the last thing demystifying treatment. And I actually think this would carry over to Asian American communities. I do a lot of work with them. Also, when I think about evidence-based interventions, unfortunately, there's just not much I can name. Dr. Ida is working on some. It sounds like that would be phenomenal. You know, I would love to just steal that as much as we can and port it, because evidence-based is a unique issue. There are a lot of, I think, community practice interventions, a lot of things that are happening that every organization in Hawaii or California is doing on their own, and yet we just have no idea. I have no idea. We can't resource. It's why this panel is just amazing, you know, hoping to kind of collect some information there that way.
Thank you very much, Andrew or Andy. There are a lot of questions that our participants have, or the viewers on this webinar have, in terms of seeking mental health and what they can do. But before we get to that, I do want to save time for that Q&A. Before we get to that, if someone can, from the panel, can answer this, you know, unfortunately, as Dr. Shea had mentioned, there's been a lot of anti-Asian hate in instances, you know, especially in the Bay Area. It just seemed like week after week, we saw an elderly person, an Asian American, being attacked. How does that affect Asian Americans' mental health? And in terms of seeking mental health when there's so much hate out there? If one of you can answer that, that would be great.
I'll just add a couple of, I think probably everybody on the panel would have something to say on this. I don't think people, the issue of hate as a mental health issue is very, very profound, because what it does, it really goes to the core. And what we're seeing, it makes people, we know that, I know Stop AAPI Hate did a great job in getting, there's over 10,000 reported incidences. Our guess, and I think everybody's guess, is it's well under that, because of the shame that it brings, that you're being attacked for the purpose of being, just because you happen to be Asian American. So there's no thing about being in the wrong place at the wrong time. It really makes people either afraid and ashamed of who they are, or I'm very proud of who I am, but it's not safe to go there. We're seeing across the country the very profound effect, and it could be just a very low grade that people may not even know what the microaggressions, what's been going on, but it really is impacting them. And so I think sometimes people are afraid to seek help because it sort of re-traumatizes them to have to relive and to talk about the fact that somebody attacked me just because of who I am. So there, it's like this little double whammy, but it is having a very profound effect. And I think, I know if we look back historically within the Asian American communities, Patty was talking about her parents. My family was the same way with Executive Order 9066. We didn't know about what they had gone through for an entire generation because the shame they bore at the racism they had faced. Hopefully it's not going to take that long for people to just sort of open up, which is why I think if we get more and more people raising the issues, that it's not anything you did wrong, but it is stuck in systemic racism. But I think, again, conversations like this, that it gives people permission and it's okay. And in fact, it's good that you do speak up and you don't own the hate, that you are saying, it's not something that I did wrong. And that's really, really key. It's being able to claim. And we always talk about when you claim who you are as Asian American, Native and Pacific Islander, that's part of the healing process because it puts you back in control. And you may not be able to stop the hate, but you don't have to own it or internalize it.
Thank you for that answer. You're right. I mean, it's up to us also to speak up and to seek that health. Otherwise, that cycle will continue forever. I want to get to the Q&A as well. We have a question from one of our viewers, and it's about approaching a family member about seeking mental health. How do you go about that?
I actually can speak to that briefly. My mother had bipolar disorder. And there were times when I would say to her, you are not right, because she wasn't right, and it can be very difficult. I mean, it can be difficult because the person doesn't always have the awareness of their own situation. It's also hard because it's so stigmatized in our communities too, to be able to say, there's something wrong. But I mean, I think we can come from a place of compassion, and say, Mom, it seems like things are really difficult for you right now. How can we address this together as a family? And that kind of approach. I'm sure someone has a more clinical response, but that was just a personal response.
And I just vibe on what you were saying. Makes a lot of sense. It's spoken from the heart, and actually people who are struggling will absolutely pick up on that authenticity. And there's a lot of really good resources out there now. And as we think about trying to attune a message to the person in front of us, as someone we care about, you don't actually need special training. Just be yourself. And, as you just said, Dr. Suyamoto, if you can share a little something about what you struggle with, and we've all struggled with something, 50% of us are directly affected, either ourselves or family members or someone we know or love has had a serious impairment. So you let people know you're willing to talk about it, and just be open about your own and what helped you get through the struggle. I've had times in my life when I've struggled, and I went to talk to someone, and it really helped me. One of our first studies we did, which was headed by our very own now Dina Wang Kraus. She's a daughter of Taiwanese immigrants. She was a medical student here. Now she's on our faculty. And she designed a study looking at these issues of acculturation stress, the conversations in family, especially across generations, and those who are immigrants raising children here. And we learned from her study that children as young as 8th grade, 13-year-olds, they differentiate. Those who are self-identifying as boys, they tend to go to their doctors because that's where they feel safest with these conversations, if they have them at all, about a mental health issue. When you compare Asian youth compared to non-Asian youth. Girls, on the other hand, who may be socialized and acculturated to develop that emotional intelligence skill much earlier and are probably rewarded in society for having those conversations, they, in her study, had a much easier time going to the trusted adults at school. So someone said, I think maybe it was Dr. Lin or someone said, you can have all these amazing treatments, but if they don't come to see you, it doesn't matter. So we can set up these trusted adults, but if the kids won't come to see you, then, we've got a lot of people with open office hours. So having the conversation by sharing your own story. And one final comment, Gunn High School here in Palo Alto, which is, 70, 80% immigrant, mostly Asian diaspora, vast majority of the parents did not go to school in the US. They're raising these teenagers, trying to be raising them in the most bicultural fashion. That school made it their mission when they were dealing with tragedies in the 20 teens to get the word out there. Students who were well-known, teachers who were well-known, the principal, they write their story. If you want to look at their stories, just do a search for Changing the Narrative. Oracle Gunn High School, it's the name of the newspaper. And you'll read these very beautiful stories that are authentic and real. And that's back to what Lisa started us with, which is have the conversation, decrease stigma one conversation at a time, and be willing to tell your own story to someone you care about.
Great advice too. Dr. Trivedi, I want to ask you, just piggybacking off of Shashank's answer there. So you're willing to seek help, you're willing to tell your story and to get any kind of help that is available. Yet there is a lack of help available when it comes to mental health professionals or psychiatrists. Maybe there aren't enough around. So then what do you do? What are the solutions there?
Yes, I think this is a really big pipeline issue, and we are actually working on it as we speak to improve the workforce. I want to just more comment on one thing that Shashank said, that um, it's important that we share within our communities and within people who we know can be our allies, but I also think it's always important to think about who else can be our allies. So if we need to go outside of our own community to destigmatize our own experiences, I would also recommend people do that, because sometimes that's where we will find our allies and that's where we'll find the help we need. So I just wanted to make that, I had come off of mute just to say that piece. And, Lisa, thank you for asking the question. I think that this is a really important issue, because we do not have culturally appropriate, linguistically appropriate care that we can provide. This is a big deficit because of the culture and because of the stigma we have come with. However, I do think that those of us who are in the profession, have a responsibility to educate providers on how people who identify as Asian American, Native Hawaiian, Pacific Islanders present, which is a lot of somatization of symptoms. And I think that that has kind of been some of the conversation we've had. And I always kind of come down to, whenever this, in the last few years, especially, there's been a lot of, at a very high level, thinking about minority, majority, whatever that means, right? And I do think that whoever considers themselves as a majority, even within this community, we have a responsibility to reach in. It's not sufficient to put the onus on the people in need, people who are feeling marginalized, people who are feeling in need, for them to then somehow dig deep and then reach out. So whether we are in the profession who are on this panel, or in the audience, or however we see ourselves as having more privilege, more of an identity we can speak out, it's important for us to reach in. So those of us who have that identity of an Asian American provider, it's important for us to reach out to our communities. And I think this panel is a good example of that. It's 7:54 on a Wednesday night, and and people are calling in from airports and whatnot. So I think that there are people like us out there, and I think it is a call to action for us. It's a call to action for us as providers, it's a call to action for us as researchers, and it's a call to action for us as educators, so that we have people who look like us be available for people who look like us and think like us and talk like us.
Thank you for that answer, Dr. Trivedi. I have one additional question before we have to close. And unfortunately, we have to talk about the shootings that happened yesterday at the Texas school. So how do we talk to our kids, our teens, young adults, about those types of shootings when they're dealing with their own mental health? How do we promote health, mental health, when we see tragedies like this almost week after week? Shashank, do you want to answer that?
Sure. I mean, there are no easy answers for things like this. And I think when you're talking about young people, there's a couple things I'll share quickly. First of all, again, just as in the last answer, and we've heard a lot of people share their own story, as university faculty, we need to hold space for our students as K-12 educators, as parents. So talk about your own reaction. I have no profound words that can heal us after the unimaginable tragedy yesterday. Only feelings right now. This is what I shared with a group of students: sadness, shock, frustration. I know we have things to do in class today, and at the same time, I want you to know I'm here for you, either now or later today. to hold space for connection, connect you with resources, or just to be in each other's company. And also, as we try to understand what happened, as we try to digest this tragedy, we need to move forward with our grief and sadness. If anyone needs extra time to study for the test or complete the final project, please send me a message so we can make adjustments as needed. And we had a number of losses in the last 18 months on the Stanford campus of students and faculty who died tragically, suddenly, some by suicide, others by other causes, but there were sudden deaths and they were profound losses. Santa Clara University, same thing. And we heard from students, when our teachers, our professors, or the kid cells, when our parents don't say anything, I mean, maybe it doesn't matter. Maybe it's not important, but it's important to me. So as the grownups or as the teachers, we've got to be the ones, as Dr. Trivedi just said, reaching in and just share our own story. I'm just messed up about this. I don't know about you all, but we can take a little time now if anyone has any comments, or I'll be here after class. I'll be in office hours. You have my cell number. So they just want to hear that they're not by themselves. And if you want to read about some ways to have conversations with your children, depending on how young they are or how old they are, if they're teenagers or young adults, the AAP, the American Academy of Pediatrics, the ACAP, which is the American Academy of Child and Adolescent Psychiatry, and the NCTSN, which is the National Child Traumatic Stress Network. NCTSN.org, ACAP.org, AAP.org. They all have really good resources for parents and doctors, psychologists, teachers to be able to hold space, have these conversations with their students or their children, depending on what the developmental need is.
Thank you so much for mentioning those resources. It's so important. As you had said, it's not a matter of just reaching out, it's also a matter of reaching in. And hopefully from the advice that we received from our distinguished panel tonight, this won't be a mental health crisis, but a mental health connection. Again, thanks for joining us tonight. Now I turn it back to Bryant.
Thank you so much, Lisa. Thank you for sharing your masterful Emmy Award-winning moderation skills with us. We are really lucky to have you here at Stanford. Thank you to Dr. Trivedi, Dr. Ida, Dr. Suyamoto, Dr. Joshi, Dr. Shea, Dr. Subika, excuse me. Also, great thanks to our colleagues who jointly promoted and thought of this event, Charlene Platon and Tracy O from the AAPI and Allies Employee Resource Group. Great thanks to Nina Lee from our Center for Asian Health Research and Education as well. And again, on behalf of all of us, really want to thank you for joining us today for this rich conversation. Based on this conversation, I wanted to, what I heard, I wanted to leave you with 3 wishes I have. In many Asian cultures, Lunar New Year and so forth, we have wishes of good fortune and happiness and health. I have 3 wishes based on this conversation. I wish that we could all feel and be safe. I wish that we could all feel and be heard. And I wish that we can all get help when we need it. So thank you so much for joining us today. Really appreciate your time. Take care.